We really are in the most challenging time that we have ever faced.
2 years into the pandemic, and the country is facing a new type of crisis.
We have a whole lot of places where, around 50% of the staff are just out.
There's a multitude of aspects of the supply chain, and they're all breaking.
Many of the foods and products we're used to seeing at our local shops are disappearing. The complex chain of manufacturing, transporting and even stacking shelves is breaking down for one simple reason: not enough workers.
This absenteeism problem is the biggest issue that supply chains have faced over the last 2 years, and that's saying something.
Michael Burge is a fresh produce wholesaler and retailer in Townsville. While he's got enough to get by this week, the cancellations and delays in deliveries means he's expecting the situation to deteriorate rapidly.
Yes, it's like waiting for that cyclone to come, We're day to day.
The 3 eastern mainland states moved on the weekend to alleviate this workforce shortage by allowing asymptomatic, vaccinated close COVID contacts to return to work with support from the Prime Minister.
The volume of cases will, of course, have an inevitable impact on the workforce. And so we're looking to maximise those who can remain in the workforce.
But industry groups say we're not out of the woods yet.
We really need to have a nationally consistent approach to these rules. New South Wales, Queensland and Victoria in the last couple of days have all made announcements that are slightly different. We're a nationally operating industry. Many manufacturers will have sites in different states, so it is incredibly complex to try and deal with different arrangements.
It's an issue that owner truck driver Frank Black has a strong personal interest in. Although he's vaccinated and takes all health precautions, he's not so keen to mingle in the workplace with people who have been let out of isolation earlier than before.
You worry about the chances you take and mixing with all the different people in the different areas, that they're working and they could be positive and I could be catching it. Yeah?
And he's angry with governments for, in his view, allowing the crisis to reach this point.
I mean, obviously we had to open up. We couldn't stay in lockdowns forever, but they should have staged it and opened up slowly, let everything be able to handle, let the systems be able to handle the opening up instead of just open slather.
We didn't need to peak this high. If we had applied public health and social measures when the numbers were going up so that we literally flattened the curve, as we talked about right at the beginning of the pandemic, so we made the peak only half or only 25% as high, we would not have the trouble now.
Despite this, epidemiologist Tony Blakely can understand why governments are easing isolation rules for critical workers.
We're in a crisis. It's about making these priority calls. For those people that we need to keep society working, as long as they're test negative, they can go back to work. The risk is there, but it's low.
The obvious answer to all this is to get people back to work as quickly as possible, back into business, back into work. But I mean, obviously there's people's health at risk, and that's got to be managed as well.
But one weakness in this plan is the scarce supply of rapid antigen tests. Michael Burge has only 10 left for his staff of more than 60.
I've been to 2 chemists this morning, neither have them. As the week goes on, there's more reactors in Townsville, the demand will become heavier.
All of this crisis is severely exacerbated by one key error, and that is not obtaining enough RATS tests and then not providing them free to people and making them accessible.
In New South Wales and Victoria, close contacts coming back into work need to have daily rapid antigen tests. Business groups say that's becoming increasingly problematic.
So we need to work with government to either secure access, particularly over this critical next month, for the industry to get rapid antigen testing to meet those public health requirements, or governments need to be practical and change those requirements and move away from being a daily test requirement.
But any further watering down of the isolation rules is likely to meet stiff resistance.
We just will not tolerate it. We won't. We can't. It's a red line. We can't send people into harm's way. Safety has got to come first.
And the whole rapid antigen testing is a debacle. We knew this 6 months ago and we haven't put in place. But we are where we are now.
A spokesperson for the Federal Health Minister, Greg Hunt, denies the rollout has been a debacle, saying state and federal governments have purchased more than 200 million tests, which will be delivered over January and February.
So those supplies will come, and this has been a challenge, and there's more to sort out on a few more rules, and they're working on those.
The question now is, where will we be in those next 2 months?
I'm hopeful, and I emphasise hopeful, that this might be the big wave and the only big wave that we have in Australia. Why? Because after this, we'll have a highly vaccinated population, boosted, and we'll also, many of us, I think a half to 2/3 of us would have had Omicron.
But that's no immediate comfort for supply chain workers.
You feel a bit apprehensive because you're going back to work where people, you don't know whether they've got the virus or not.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 730's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.